Hello, my name is Dr. Henry Silverman, and today I would like to explore the concept of professionalism in the practice of medicine. This slide shows the agenda for this presentation. We will begin by exploring what is professionalism. We will then discuss how professionalism incorporates aspects of humanism. This will be followed by exploring the concept of the hidden curriculum and its role as a barrier to fostering professionalism. We will next visit the topic of how professionalism can be taught, and then we will end by discussing the concept of medicine's contract with society. Although professionalism has been incorporated into most medical schools, it remains rather difficult to define because it carries many implied meanings. One definition is shown in this slide. Medical professionalism signifies a set of values, attitudes, and behaviors that serve as a foundation for the trust the public has in doctors. Essentially, professionalism attempts to make more clear certain values, attitudes, and behaviors that are desirable among the medical profession. Such behaviors form the basis of patient trust in medicine. I would like to emphasize three key words in the previous definition: values, attitudes, and behaviors. Values are the sources of attitudes and behaviors. As such, professional competence is the habitual use of essential values in daily practice for the benefit of the patient and the society being served. What professionalism is not includes the following: unlimited autonomy to do what you want, clinically and financially, freedom from regulation, and freedom from scrutiny. Professionalism includes several values. First and foremost, physicians need to be competent. That is, they need to have the required knowledge to practice medicine. Along the same line of thought, physicians must have the necessary communication skills, not only to obtain the necessary medical history, but also to be able to offer information to their patients, educate their patients, and to establish and maintain a therapeutic relationship. Altruism refers to the physician's ability to constantly place the patient's interests before their own. Physicians need to be accountable or take responsibility for their actions, which entails adequately monitoring standards of practice. But also, physicians are now accountable in financial terms as well. Their so-called economic accountability is to the current payers for health care, including the state and/or the market. Essentially, physicians are being asked to ensure that their services are cost-effective and are, to an increasing degree, being asked to include in their decision-making the impact on the overall economics of health care. Physicians must also be a source of objective advice by avoiding conflict of interest. Compassion is another important value, which is a concern for the sufferings and misfortunes of their patients. Compassion is to be distinguished from empathy, which entails that physicians attempt understanding of what their patients are feeling and experiencing. And finally, physicians must demonstrate integrity, which involves a firm and consistent adherence to moral values, a so-called state of being whole and undivided. We see how these values and others serve to uphold the ethical principles of medical practice. For example, respect for autonomy is served by the values of honesty, providing education, all of which enhances patient empowerment. Patient welfare or beneficence is served by the values of altruism and accountability. And social justice entails treating patients equally, providing treatment in a non-prejudicial manner, and using available resources wisely. This slide shows in a picture format how a concept of professionalism requires a firm foundation consisting of the values that we have been discussing. The demonstration of professionalism consists of exhibiting behaviors in accordance to a set of normative values and expectation. But such behaviors are more likely to occur consistently if humanism is an important ingredient of professionalism. Humanism denotes embracing an intrinsic set of deep-rooted convictions about one's obligation towards others. And hence, it is humanism that leads to a robust concept of professionalism. This point is made clearer in this slide. What may occur when one fails to embrace humanistic values is what I like to call pseudo-professionalism, whereby what you do may seem intact, but without humanistic qualities such as seemingly correct behavior can be undermined when under duress or when no one is watching. As such, humanism drives authentic professional behaviors. Such behaviors is harder to undermine when under duress. Essentially, humanism ensures right actions when no one is watching. This slide shows, in a picture way, the importance of humanism. Exhibiting certain behaviors such as competence, compassion, altruism, and the others listed in this slide may look like professionalism, but such behaviors will not be consistently demonstrated without a foundation consisting of the values we have been discussing. Why is professionalism at times so difficult to maintain? Our personal issues can at times frustrate professionalism. For example, difficulties at home, overburdened with work, challenging situations at work, and time constraints. How do we prevent personal issues from affecting us? One must maintain boundaries between our professional and personal lives. We must constantly ask, what is your purpose here? Why are you here? What is the goal? Who needs are supported to be met? Of course, if our personal life becomes overwhelming, one must seek help. An example of how workplace pressures can foster unprofessional behavior is demonstrated in this case study. A 36-year-old woman is admitted to the team for chest pain after using crack cocaine. She is the third person admitted to the team that day for crack and the 8th overall. Although the team was capped, they were exhausted. The resident is known to be excellent. However, they say on rounds, we need a crack team. The medical team consists of 2 interns, 2 medical students, and a pharmacy resident. Crack team. Take crack call, do crack consults, and follow up the patients in the crack clinic. The team explodes in laughter at the expense of the patient. This is unprofessional behavior. The resident usually demonstrated professional behavior and professional appearance normally when he's not under stress, but now he was under duress and his team was carrying a great workload. And hence, the team and the resident was frustrated with the impact of so-called patients on crack on hospital utilization. However, his behavior reflected some missing humanistic values that undermine professional behavior. So how do students learn professional values? It comes from several sources. Some bring it to medical school with them, some learn it through the so-called formal curriculum, and some learn it from role models on the wards. What we learn on the wards is what we now call the hidden curriculum. It is called a hidden because it represents not what is explicitly taught, but what is learned in the environment from behaviors both proper and improper. It represents a set of influences that function at the level of organizational structure and culture. The rules of culture are learned through non-overt attitudes and behaviors of peers, educators, administrators, and others. Essentially, what we have is the situation shown in this slide. Values, as we said before, shapes behaviors. But these values, which are well-meaning at the beginning of training, are transformed by the hidden curriculum, leading to unprofessional or improper behaviors. The challenge then consists of how does one impart knowledge of professionalism to students, residents, and faculty? How to encourage the behaviors characteristic of a good physician? Essentially, how can professionalism be taught? Well, there are several strategies. One can teach it explicitly, but that does not gain much traction. One needs to complement the teaching of professional values with other strategies that can include role modeling, which consists of faculty showing correct behavior towards patients on the wards, the use of simulated patients with subsequent feedback, small group discussions where students can feel safe to discuss their interactions, and then the use of reflective writing, where students can sit down and constructively reflect on their behavior as well as the behavior of others. One needs to depend on role modeling consisting of interactions with patients on rounds, observing reactions to patients, observing behavior under pressure, and the use of conflict management. I also recommend reflective writing. Essentially, reflect on what you have seen and what you have done. The reflective writing class blog using technology to promote reflection and professional development is shown in this slide. The last point I would like to discuss involves the existence of medicine's contract with society. The role of the profession and the definition of professionalism is not determined by the profession in isolation, but by negotiation of the social contract with the society we serve. The social contract in healthcare hinges on professionalism. It serves as the basis for the expectations of medicine and society. The social contract consists of expectations both by society and by medicine. On the one hand, society's expectation of medicine involves several aspects as shown in this list and contains much of what we have discussed already. Fulfill the role of the healer, assured competence, altruistic service, morality, integrity, honesty, code of ethics, accountability, transparency, source of objective advice, and promotion of the public good. In return, medicine has expectation of society and includes the several items shown on this list. Trust, autonomy, self-regulation, a healthcare system that is adequately funded, patients accept responsibility for health, an assured monopoly, and rewards, both non-financial and financial. To summarize, what is professionalism? Well, it consists of standards of competency and skill, which includes mastery of a body of knowledge, maintenance of technical skill and competence, provision of a healing service, and continued self-improvement. But it also consists of a set of values that lead to proper behavior. Altruism, integrity, honesty, transparency, justice, a duty to serve, to teach, to advocate, and a duty to participate in the betterment of the profession. In conclusion, professionalism is a challenge and a mandate in medical education. Values lead to our behaviors. Professionalism at the surface is what you do when everyone is looking. Humanism defines who you are when no one is looking. Imagine yourself in the patient's shoes and reflect on everything. Thank you very much.